from treatment. Well, my next question is, considering that the majority of patients have been under conventional cancer treatment prior to their admission to Hope4Cancer, how do patients respond to the use of alternative medicine and its outcomes?
So, first of all, we want patients that come to Hope4Cancer treatment centers to want to be here. Right? Because sometimes they're pressured by family, right? The spouse, the daughter, the son, oh, don't go into alternative medicine, right? However, most of them, 92% of them, have already done conventional medicine.
Okay.
And then they have to deal with that fear factor.
Yeah.
That even their oncologist, who knows that the treatment is not effective, they say, well, let's do this clinical trial. Let's do more chemo. Let's change the chemo.
Yeah.
But the more chemo that the patient has had, the more resistant that cancer is, the more side effects, the more toxicity. So our outcomes are quite significant in the sense that even though we're dealing with stage 4 cancer patients who have had a lot of toxicity and aggressive therapies and have not had the results that they want. Some of them may have had partial results for some time, but then the relapse, right, the recurrence is when we see these patients. So we are just blessed, Jay, to have the results we have following the 7 key principles. 70% of our stage 4 cancer patients live at least 5 times past the expected prognosis.
Wow.
What that means is when they came here, they were expected, let's say, to live a month, 3 months, weeks sometime. They're living at least 5 times that with good quality of life. And as I mentioned earlier, when we looked at the 4-year survival data compared to the National Cancer Institute, is at least 3 times higher. And now what we're doing is we're doing longitudinal studies because according to conventional medicine, and when they approve a drug for cancer, chemotherapy for example, or an immunotherapy, all they have to show is that the patients are living 3 to 6 months longer, and then the drug is approved. That's not Dr. Tony saying it. That's what a medical director at a major institution in the U.S. told me. He said, Dr. Tony, just do a longitudinal study.
Wow.
Right? So we, of course, are going to do that because that's what conventional medicine wants to see. But it's more about living 3 to 6 months longer, right?
Of course.
Yes.
So the results generated here it far surpasses what's expected out there.
Yes.
That's great.